This educational program is sponsored by Eli Lilly and Company in association with the International Society for Bipolar Disorders. We live in a culture that celebrates extremes. Bigger, faster, louder. Pushing ourselves to do more in a day, in a life. For most of us, the extreme is an occasional state, something we can control. But what happens when the extreme becomes everyday existence? For people with bipolar disorder, the experiences of daily life get pushed to the edges as their moods cycle from highs of productivity and energy to lows of deep sadness. This program will examine bipolar disorder through people who live with it and doctors who treat it. Because with proper treatment and support, people with bipolar disorder can live balanced lives.
Bipolar disorder is a primary mood disorder, and it's characterized by alternating periods of mania and depression. And it affects people's ability to function interpersonally with their jobs in social situations.
I had irritability, I was happy, I was sad, up and down, two opposite ends of the spectrum. I had both.
I was processing something else in my own mind, which was, now that I know it was sick, it was illness.
It's something that affects your whole life. It affects your physical health as well as your mental health and everyone around you.
It's an illness that's characterized by distinctly opposite mood states, but also by mood states that can occur simultaneously.
In bipolar disorder, individuals swing from extremely elevated moods, called mania, to extremely low moods, called depression. In fact, bipolar disorder used to be called manic depression. Individuals may also experience a spectrum of moods in between, often including periods of normal mood. Certainly all of us experience a range of moods on a daily basis. But what defines bipolar disorder is the severity of these mood swings.
And so even though we might have all had feelings of being happy, and we've all had feelings of being sad, this is a brain chemical disorder of severe extremes of those that are beyond the person's immediate control.
The very phrase bipolar disorder makes us think of moods as two opposites, mania and depression. But the moods of bipolar disorder actually present along a continuum. The illness is often diagnosed according to severity as either bipolar 1 or bipolar 2 disorder. Bipolar 1 disorder is characterized by full-blown manic episodes that may include delusions or hallucinations and can result in hospitalization. Bipolar 2 disorder is diagnosed in people who have milder manic episodes that do not interfere with their daily functioning. Both bipolar 1 and bipolar 2 include episodes of depression. Regardless of severity, all bipolar disorder has the same origin. It is a mental illness rooted in biology.
We do know that the genes predispose individuals to bipolar illness. Now the question is, how do these genes bring about the symptoms of bipolar disorder in a given person? We think that is due to some chemical changes and perhaps some structural changes in the brain.
While there is still much to understand about bipolar disorder, doctors can usually make a diagnosis by looking at a patient's family history and clinical history and conducting an interview.
In some cases, it can take 5 to 10 years before we realize that someone actually has a bipolar disorder. Sometimes people don't even seek treatment after the initial onset of symptoms. And if they present just with a depression, it could be many years before they have a subsequent episode. And if it's another depression, we could just think, well, this person has a recurrent depression.
Proper diagnosis is critical because bipolar disorder can devastate a person's relationships, career, finances, and in some cases, can even be life-threatening.
15 to 25% of people with bipolar disorder will attempt suicide at some point in the course of their lives. And if untreated, and that's an important piece of this, if untreated, up to 20% of people can successfully complete suicide.
This is a disorder that affects not just the quality of life, a person's ability to maintain a job and finish school and to maintain their relationships, but quantity of life.
To understand bipolar disorder, we must understand its two main mood states. We begin with mania.
Mania is characterized by distractibility, very easy distractibility, inflated self-esteem or an exaggerated sense of self-confidence.
I went off on tangents and I couldn't get back to where I was before. I couldn't resume my focus.
There would be days where I thought I could write a great manifesto to change the world and bring about justice.
In some cases, a person could have grandiosity to the point of being delusional. Over 44% of people with mania will present with some kind of psychotic symptoms. And if the delusion is such that they think that they have maybe superpowers, have special relationships with important people, etc.
I wandered through the city, just really completely lost, feeling as though I was on some sort of spiritual journey.
The person with mania may also present with pressured speech, which means there's such incredible pressure to get the information out. They talk very rapidly and often in a loud, expansive manner.
My mind was racing so quickly, and it was so fascinating because I thought I was having wonderful insights into my thought processes, and it was like I could see the neurons and the neurotransmitters racing there.
Someone in mania may also engage in increased purposeful activity. They might have lots of increased energy such that they are cleaning the house all night long, they're painting, writing a book.
I'd start writing a new story, maybe start a novel, and then, after a week or two had gone by, I'd put quite a bit of time into it for that week or two, but then my ability to stay with it would just disappear and I'd be on to the next project.
Some people with mania will get themselves into difficult situations where they spend money that they don't have. They'll engage in sexual indiscretions and get themselves in financial, marital problems and job problems, sometimes legal difficulties as well.
I've done some pretty bizarre things in a manic state. I've overextended myself financially many times, sometimes frivolous, bizarre behavior, bordering on criminal behavior at times.
I was 17 and I was getting into some drugs and driving faster and hanging out with a lot of women.
They have increased energy to the point that they absolutely don't need to sleep. The mood can also be irritable, and that's where the person tends to get into a lot of trouble. They can get into physical altercations or verbal altercations because of their extreme irritability.
And I felt great. I didn't think anybody could stop me. I didn't think I could stop me.
He seemed very aggressive and confrontational. Really, I just wrote it off to this is our first major blowout. And I asked him to leave the home. And he had an apartment at his college. And so I said, you go to your apartment, you stay there, and please don't come back here for a while.
Sometimes mania does not present in such an obvious or extreme manner. Many individuals with bipolar disorder experience what is known as hypomania.
Symptoms of hypomania are identical to the symptoms of mania, except they're less severe. So we diagnose hypomania when someone has pressured speech or a decreased need for sleep or is speaking rapidly, but that those behaviors do not interfere with their day-to-day ability to get along.
Every summer I'd have a lot more energy. I'd start sleeping less, and I wouldn't have termed it mania. I didn't feel I was out of control. I just thought that I was the same person as I always am, with a lot of energy.
Episodes of mania can be triggered by environmental factors like lack of sleep and stress, but they can sometimes also be triggered by medication. Bipolar disorder is frequently misdiagnosed as clinical depression because many patients only seek medical treatment when they feel depressed. But for a person with bipolar disorder, treatment with antidepressants alone may push them into mania.
I was put on an antidepressant, and yes, it did cause a manic episode in combination with a lot of other things in my life. The first couple of weeks were okay. I was smiling, things seemed good, I was sleeping. 5 to 6 to 8 weeks later, within 8 weeks, I was in the hospital because I'd had that manic crash.
Contrasted with the energy of mania, the depressive phase of bipolar disorder can be debilitating. It is often this aspect of the illness that leads people to seek treatment.
I didn't understand. Why am I crying? Why do I not feel like getting out of bed? You know, there's nothing wrong with me. There's nothing wrong with my life, and I don't know why this is happening.
The symptoms of depression include persistently depressed mood, sometimes a mood state so low that people can't feel anything anymore.
Patients during depression